Good afternoon and welcome to Your Health is Wealth. I'm your host, Dr. Stephen Katz, alongside my co-host, Dr. Loreena Ryder. We help navigate your journey to wellness, but we like to do it simply without all of that horrible, confusing medical terminology that everybody hates. We're here to provide practical solutions to your health issues that allows your healing systems to do the work for you. It's simple, it's natural, and it works. If you're still struggling with your health, you can come see us at Naturopathic Physicians Group to help get your life back.
Topic of the day today is hormones and bioidentical hormone replacement therapy. I'm excited about today's session here. This is my jam. So we're going to talk about mainly hormones today and what symptoms you might have if your hormones are not regulated, whether they're high or whether they're low. Also, in the second half of the show today, we will be interviewing pharmacist Dr. Castorline. He works at Raintree Apothecary, compounding pharmacy in Scottsdale. And with Corey, we'll be discussing the differences in quality when you get to choose your hormones compounded. It's an individual prescription versus the synthetic stuff that's cookie cutter at retail pharmacies.
The crap at the retail pharmacies.
You said it.
But here we are. So today there are adrenal glands. So the adrenal glands are what actually makes a lot of your hormones. There's two big components to your adrenal glands. You've got the adrenal cortex, which is responsible for your sex hormones. That's going to be your DHEA, your testosterone, all three estrogens. And yes, I said all three estrogens. A lot of people out there think they only got one. It's true.
Or none.
Or none. Yeah, if you're menopause, or none. Yeah, and then also progesterone. And then there's also the adrenal medulla, which is responsible for your stress hormones like cortisol and cortisone. But today we are going to focus mainly on the adrenal cortex and the sex hormones.
So let's start at the beginning. That's the best place to start. Where do hormones come from? They come from cholesterol, which I find a lot of patients are quite surprised by this. So without cholesterol, your adrenals do not work properly. You need a minimum amount of cholesterol to even make adrenal hormones or sex steroid hormones. Think about the side effects of taking your statin drugs. Statins lower cholesterol. Many of statin drugs are linked to lower adrenal function and also lower hormones. The symptoms would be fatigue, erectile dysfunction in men, hormonal issues, anxiety, and all of that.
And again, we're never telling you not to start or stop any medications. That's not our job. We try to give you information. But if we're telling you that one of the most common prescriptions in the world out there are anti-cholesterol drugs, and then some of the side effects associated with that can be ED for you men out there, or irritability and fatigue and anxiety, and all of those hormones are made from cholesterol. So if you don't have that cholesterol in your body, because of your statin drug, a lot of your side effects might be associated with what we just said.
Yeah, and this can happen with the quote unquote natural statin, the red yeast rice, because it does have the same mechanism of action. So just because it's not a prescription medication, you want to keep that in mind as well.
But the difference is that when the conventional drug companies get their mitts on a lot of the natural things, they like to, I'm not going to use a bad word on it, but they like to screw with it a little bit, make it a lot more potent and create a lot more issues with it. So even with the side effects potential on the natural, the side effects on the natural ones are still a lot less likely to happen than someone doing a huge dose of Lipitor or any of the other statins as well. You're way more likely to have a side effect. And again, oftentimes those side effects might be linked to what you're actually doing with that drug, like lowering cholesterol, which then lowers your adrenal function.
Yeah, 100%. So let's start talking about the hormones, DHEA, and let's talk about symptoms of DHEA deficiency. So this, you may have never even heard of DHEA, didn't know it was a hormone, but it is in the family with estrogen, progesterone, testosterone, and it is quite important. So if you do not have enough DHEA in your body, you can experience hair loss, both on the body and the scalp. Your sex drive can take a dive or be just not there, non-existent. Erectile dysfunction in men.
Not being there, not existent again.
Yes, that. Dry skin, dry hair, and dry eyes can be a symptom of DHEA deficiency, and also hypersensitivity to light and sound.
Yeah, definitely can affect sleep, your mood. If you're low in DHEA, because DHEA is a precursor to testosterone. So lower testosterone in men, and we'll get to their more detail when we talk about testosterone, but we'll link to increased stress, increased anxiety, depression, mood swings, and not the good mood swings, the bad mood swings. It affects your memory, it affects your energy, your muscle mass, joint pain. A lot of different things can be associated with it, and it could start with DHEA. And that's important to think about it because so many people jump right into testosterone when they're getting treatments. And what if it's actually a deficiency of DHEA and your body's not converting the DHEA into the testosterone? You don't always have to jump right into the heavier duty drug.
And people with osteopenia or osteoporosis might want to pay attention here too, because DHEA actually plays a role in bone building. So you may have a deficiency if you have osteopenia, osteoporosis, and might want to supplement. So there are also problems with too much DHEA, mostly in women, because like Dr. Katz said, it does build testosterone, and women are not designed to have as much testosterone as men. So if we have too much DHEA, we might experience body hair and facial hair that normally isn't there. We may have a deepening of voice. We may have menstrual disruptions, acne, anxiety, irritability, and hair loss at the top of the head. And this is all basically like male pattern symptoms, most of these, because we might have too much of those androgens, those male hormones.
So what does DHEA support? Again, we talked about it: energy, focus, mental clarity, immune system support, helps with your bone health, helps with your muscles, helps with your cardiovascular, big help with your libido, and can help with your insomnia. It can get people into deeper REM sleep. And then DHEA, when you have it balanced, because again, hormones are always about balance. If you're high, if you're low, there's going to be problems. When you have DHEA balanced, you're going to have less abdominal fat. You're going to have better cardiovascular health. You're going to have better energy. You're going to have less depression, and you're going to just feel better.
DHEA is pretty important, and I think it's a forgotten hormone sometimes. So, shall we talk about testosterone? That's a big one. So let's talk about symptoms of low testosterone in men. Top 10, reduced libido and sexual desire, erection problems, hot flashes, night sweats, depression and anxiety, brain fog, reduced memory, sleep disturbances, decreased muscle mass and strength, increased body fat, body and facial hair loss, bone loss, and osteoporosis. That doesn't sound fun.
Stuff. It doesn't sound fun.
Yeah. So we'll talk about testosterone more, but just giving you a little teaser there is what's ahead. So thanks for tuning in to Your Health is Wealth. We're the doctors from Naturopathic Physicians Group, and we will continue talking about hormones and how they affect your life if they are not balanced. Welcome back to Your Health is Wealth. We're the doctors from Naturopathic Physicians Group. We discuss a different topic about natural remedies for your health every week. Today's topic is sex hormones and how balancing them may help you have a long and healthy life.
So in the last segment, we started talking about testosterone. What are the signs if you have too much testosterone? This is common in those teenage boys out there because they tend, not that they're too much, it's just they feel it a lot more than the little bit before they hit puberty. So the signs of too much, they're going to have that acne, that oily skin. But if you're an adult and you have adult acne, it could be too much testosterone as well. But mood swings, irritability, aggressive behavior, sleeping issues, reduced sperm count if you have too much and you're an older male. It can enlarge your prostate. Probably not too much of an issue in those teenagers out there. But as you get older, if you have too much testosterone or you're using too much testosterone, that can affect your prostate, can cause headaches, and also that male pattern baldness, that hair loss as well.
So women have testosterone as well, not as much as men. But if a woman has too high of levels of testosterone, they will experience deepening of voice. Their menstrual cycle will be upset. These are the same symptoms that a high DHEA would have, because remember, DHEA makes testosterone. Women may have decreased breast size with too much testosterone, excessive facial hair growth and body growth, enlarged clitoris, male pattern baldness, meaning you get bald right above the temples on the either side of the forehead, acne and oily skin. And I think everybody knows that testosterone causes mood swings and aggressive behavior, both in men and women. And it can also affect your cardiovascular system.
But what are the benefits if you are on the right? Again, it's always about balance. What are the benefits? If you have it balanced correctly, you can actually have hair growth. That's good, right? It increases your sex drive. This is the reason why most men will want to get on testosterone, because they're having erectile dysfunction. They're not performing. They might be 60, but they're coming in the office saying, I want to feel like I'm 20. Testosterone tends to be involved with something like that. Their confidence goes up both sexually and just in their general day-to-day function. Memory is improved. Red blood cell production. Their bone mass is important, both men and women. If a man is low in testosterone, they have a higher risk of osteoporosis as well. But the muscle strength, the endurance, exactly.
So let's jump over to estrogen. So earlier, Dr. Katz said we have 3 types of estrogen. E1, E2, and E3. We'll make it pretty simple.
Can't make it harder than that.
So E1 is, as it's called estrone, but we'll just call it E1. It's the most common form of estrogen found in increased amounts in postmenopausal women. I like to keep an eye on E1 in labs because this is the inflammatory estrogen. This is the one that you want to keep tamped down, especially for those women who have a family history of cancers. You just want to make sure that inflammation is not on the rise there. You want to talk about E2?
Sure. E2 is the main estrogen when you are in your reproductive years. It's also the reason why when you go in menopause and you're no longer reproductive, you're still productive. You're not reproductive. But when you get into when you are no longer in your reproductive years, this estrogen drops dramatically, which then increases your risks of osteoporosis, psychological things, mental well-being. You're talking about coronary artery disease. There's a lot of things associated when women go into menopause, and that's partly sleep issues become very common with that. The mood swings again. Did I say mood swings? The mood swings again. In general.
Yeah, E2 is a big deal. It's a big deal. So this is when it's called estradiol. When estradiol drops as you're going into menopause, this is what causes the hot flashes and the irritability and all of those negative symptoms that are associated. Not all, I guess some can be made from others. But yeah, E2 is a big deal. And then you have E3, which is estriol. This is a protective estrogen. This is something that we like to give in hormone therapy in conjunction with E2 because it's a balancer. It's an anti-inflammatory estrogen. It's the nice one. It's the one you want to have there to make everybody friends.
The body needs it all. It's just about the balance. And we'll get into more about the different types, but you need to balance the anti-inflammatory with the inflammatory estrogens. And if anything, you want more of the anti-inflammatory because now you're talking about being protective on things like breast cancer, ovarian cancer, versus more inflammatory is going to lead you more risky when it comes to the breast cancer and the ovarian cancer.
Right. And some symptoms of low estrogen, you might be having missed periods or irregular periods. You can still have hot flashes as a young person if you have low estrogen. This isn't all just menopausal. Tenderness of breast, headaches or migraines, depression, fatigue, trouble concentrating. Low estrogen can cause a decrease in libido or sex drive in women. Also pain during intercourse because the vaginal canal is just not as lubricated and as the integrity of the lining is just not there with low estrogen.
And what a lot of men don't understand is that just jumping into testosterone, there's a process out there called aromatizing that can take the testosterone you're giving your body and convert it into estrogen. So you're trying to improve your sex drive, you're trying to improve your ED, and you actually give yourself man boobs and make you even floppier.
Yeah, that
I don't know if I'm supposed to say floppier, but the truth is this can happen even using testosterone. You have to be careful when you're talking about dosing and making sure you're doing it correct. More is not mean better. It's about balance. And they do make drugs out there that try to stop that conversion. But again, do you want to be on another drug? So you really have to make these conscious decisions when deciding what's the right treatment for you. And again, we're big proponents on using correct hormones, and like we use them, but it's always about balance. It's about the correct form and the correct balance to make sure you're feeling your best without the potential side effects.
Yeah, and high estrogen is almost the same side effects as low estrogen, minus the painful intercourse and lack of vaginal lubrication. But you can have swollen or tender breasts and irregular period and PMS symptoms and bloating and headaches and all of those things. And that's why the balance is so important.
Yeah, and let's get into progesterone. So progesterone, another very common hormone as you get into menopause, where it starts to deplete. Very similar symptoms in a lot of ways to low estrogen, but they're not all together. But like hot flashes can happen with low progesterone, facial hair growth, hair loss in the areas. You don't want to lose hair growth in the areas you don't want to gain hair. So it can be combinations of that. It can make you infertile. People that have recurrent miscarriages, you should check your progesterone levels. That could be a major cause of that.
Huge. Progesterone is actually my absolute favorite hormone. I call it the happy hormone. And this really does start to decrease in women in their 30s. And with endocrine disrupting compounds and our dirty world that we live in with pollution and plastics and so on, it tends to hit women even younger than that sometimes. I'm seeing that in clinical practice now. But progesterone tends to basically be the anti-bloat hormone, the happy hormone, the balancer of the estrogen. So if you've been told you have estrogen dominance or endometriosis, progesterone is a really great balancer of that condition. The anti-anxiety hormone, this hormone even helps relax your blood vessels. So if you have hypertension, it might not be a bad idea to check your progesterone to see if you're lacking in that.
And sleep, if sleep is one of your biggest concerns, like insomnia, low progesterone is a huge component to that, especially if you're in postmenopausal age and you always slept well. Because I'll hear that a lot from patients where I never had trouble sleeping, and then I hit menopause and all of a sudden I can't sleep at all. And it's not hot flashes. It's not that they're waking up sweaty and drenched and have to change their clothes. It's just they're not sleeping well, and it's not the hot flash, and it could be progesterone. Fibroid cysts, anxiety, again, those mood swings, it even affects your blood sugar. So it is one of those ones again. And progesterone is interesting too because it's like a connector both to your stress hormone and estrogen, your sex hormone. So it's like an in-between step. If your body's in higher stress, it will take that progesterone and convert it into your stress hormone, which then depletes your natural estrogen. So that means if you were already low in estrogen, you just depleted it more because you were under high stress.
Yeah. And if you have been told you have ovarian cysts, probably have low progesterone. The amount of patients that come in with these issues that have perhaps gotten a uterine removal some point in their life, I feel like it's because of fibroids or ovarian cysts or endometriosis. I feel like if I would have gotten a hold of them earlier, I might have prevented that. And that just makes me sad.
Got them now.
Yeah.
So high progesterone can also cause issues, breast swelling, breast tenderness, bloating. A lot of patients that'll be the reason why they go to see the doctor, because they're feeling that bloating, which then causes them to have the weight gain, which they hate, of course. Headaches, anxiety, irritability, fatigue. Again, it can increase your stress. It can also increase your acne. But the weight gain's the big one that gets people in the office.
Yeah, I've never actually seen this in practice. Progesterone, I've never seen high progesterone.
I have, but it's usually because they were doing pellets before,
Yes.
and they jacked up their progesterone super, super high, and they can't seem to get it back down.
There's a reason.
But everything we just said, if you're taking progesterone and you are doing it correctly, you're going to have those benefits. You'll have more energy. The muscle mass will be good. You'll sleep better. Your concentration's going to be better. You'll have hair in the right places. That's important, right? Your bones will be more protected. Your skin will be cleaner. A lot of things when your hormones are balanced. We are the doctors from Naturopathic Physicians Group. And in our next segment, we are going to be talking with Dr. Corey Castorline, and he works at Raintree Apothecary about hormones.
We are pleased to interview Dr. Corey Castorline, PharmD, who works at Raintree Apothecary. That is a local compounding pharmacy that specializes in compounded prescriptions, including bioidentical hormone replacement therapy. So if you're interested in checking out Raintree Apothecary, they are at 9260 East Raintree Drive, Suite 150, Scottsdale, Arizona. Basically, out our front door, walk across the parking lot, and you'll run into them. Their phone number is 480-912-5959.
Hi, Corey. How are you?
Good, good. How are you guys?
Living the dream.
Pleasure to be here. Thank you for having me on the show.
For starters, we wanted to bring in a compound pharmacist to talk about the difference between the conventional pharmacy and the compounding world, because there's so many misconceptions out there between using hormones and not using hormones. So for starters, like, what made you want to be a compound pharmacist versus a retail pharmacist?
That's a great question. For me, I really wanted to collaborate with the patient and the doctor, be a part of a larger conversation, focusing, of course, on health outcomes and also customization, being able to have my hands in making the medication personalized for every patient that walks in the door. That really appealed to me.
So when you're talking about like customization, because most of the time when people get their prescriptions, here's 20 milligram, 40 milligram, 60 milligram. So what does customization mean with regards to compounding?
Yeah, great question. So with customization, a lot of commercial medications, blood pressure medication, for example, there's certain doses that are commercially available. But if it's something where you have a blood pressure medication, the strength is too high, and you need something that's not commercially available, you can go to a compounding pharmacy and have a lower strength made. If you're allergic to certain ingredients in the commercial medications, like food colorings, fillers, and things like that, it can be made a bit cleaner in a compounding pharmacy with just the essentials.
Yeah, I visited Raintree Apothecary, took a little tour in there, thought it was quite clean and sterile looking, but I was intrigued because it's like a kitchen where you have the ingredients all up on the shelves, and then the pharmacists literally make your prescription individually, how the doctor prescribes it for you. So it takes a little longer to get those scripts because they are individually made for you. But what I found with patients is there are a lot of patients out there who have never heard of a compounding pharmacy. And so maybe you can talk to us about the differences, which we touched on, between conventional and pharmacy.
Yeah, no, absolutely. So compounding offers a lot of choice for the patient, and that's very important in the health space. There's not enough choice. There's not enough taking the input of the patient, what their needs are. Like you described, is exactly right. We work with a lot of different ingredients. We specialize, like with the show topic, hormone replacement therapy, but we can take individual ingredients, discuss levels, work with the doctor to come up with dosage forms that aren't really available in a commercial pharmacy. We can make creams, we can make lozenges, we can also make capsules as well, rapid dissolve tablets, even oils that you dissolve under your tongue. It gets really amazing the ways you can customize and create different formulations just depending on who your patient is and what they're looking for.
Yeah, I was a pre-pharm major in undergrad, so I was supposed to be a pharmacist, and I worked in a retail pharmacy for many years, enjoyed the job, but one of the things that really pushed me into a different realm was the lack of connection between the pharmacist and the patient. And again, I loved working with the pharmacist, but these were things the pharmacist would tell me. They'd be like, it used to be when they would work in their mom and pop shops, they'd have a lot of interaction with the patients, and then it became very commercialized, and now it's just about how many scripts can we do in a day. And it was discouraging to me. So I love the idea with a compounding pharmacy where they can have a lot more connection with the patient, a lot more like the old school pharmacies used to be.
Oh, yeah. No, you're absolutely right. Unfortunately, with the retail side of pharmacy, there's a lot of corporate inputs, a lot of insurance input as well in terms of numbers they have to produce and campaigns that they want to push through the pharmacies to get patients on certain medications, and takes away a lot of that individual time with the patients where they just don't have that one-on-one time. That's just so important when it comes to listening to patients, collaborating with other professionals, really getting a very well-rounded care for the patients.
That sounds like a naturopathic thing we've said how many times? Because
Right.
it's like that's partly why we loved being naturopathic doctors. It's
Yeah.
that individualized care that we present with every single patient. And that's why we naturopathic doctors tend to love bioidentical hormone replacement or just compounding pharmacies in general, because we can pinpoint the exact dosing we want and be as protective as we can, getting rid of all of the stuff. You said earlier, like artificial colors, flavors, sweeteners, all of these things in these medications. What do you guys do differently? Because if you take away the sweetener, I assume it tastes like crap.
So we can definitely go that route. We definitely have patients who want it as natural as possible. So we'll use yam-based progesterones, testosterones, and we can just put it in something as simple as almond oil and have it patient use it sublingually if they want something really clean. If they're looking for capsules, we can formulate it in a way where with progesterone, usually we're working with higher strength, so we just have a gelatin capsule that's just derived from cow sources, or we can have it derived from vegetable sources, and then we just have progesterone, and then that's it. So it's definitely something where, in terms of worrying about other ingredients that can cause digestive issues or absorption issues, we can really have a handle on that. And
it always drove me crazy when I would read ingredients of the antibiotics they give to kids, and it's full of fake colors, it's full of fake sugars. Here we're trying to help the kids get better, and then we're putting multiple toxins in that ingredient.
Oh,
so I assume if we made the same kind of antibiotics with you guys, we can make it without the toxins and without the sugars and without the fake stuff, correct?
Oh, yeah, absolutely. In my experience, I've had kids come through who needed a special dose of a blood pressure medication, and we were able to make things like a gummy for them to chew and swallow. We have patients who have maybe some psychological issues where they have anxiety issues, and we can make doses of alprazolam in liquid form that are easier for kids to take and swallow and things like that. So it's amazing what we can create.
I really do appreciate all of that, because I can call up Raintree, talk to Corey, and say, hey, is it possible to make this in this form at this dose, this delivery system? And he'll say, let me see what we have. Let me see if we can pull in that ingredient. It really is just a matter of getting with your doctor, doing the ingredient that would work for you. There are things out there like in sclerosis that's really hard to treat.
Yeah.
And so I'll get on the phone with Corey or one of his colleagues, and we'll start talking about what ingredients they are able to get in, the herbs that I know that will help, and we'll put together some topical herbal ointment that has been amazing for some of my patients.
And I've had patients to where I don't even change the medication or the dosing. I just take the junk out of it and have you guys compound it, and they get better without the crap in it.
Oh, yeah.
What do you know?
What a concept. Let's just take the junk and the toxins out of the product, and then magically they still get better.
Oh, yeah.
Another thing I really love about the compounding pharmacy way, their methods, is that I can ask you to add a sustained release formula to pretty much any capsule.
Oh, yeah.
So if I have somebody who's not sleeping and we're trying to use progesterone to help them sleep, and that sustained release, you use methylcellulose for
That's
that,
correct.
right?
Uh-huh.
That will release it slowly throughout the night and help them get a full night's sleep.
And those powders are naturally derived too from plants, so it's great.
Very nice. I'm Dr. Loreena Ryder. We are here to discuss different topics on health and natural ways to treat them. Today we are talking about bioidentical hormone replacement therapy and how compounding pharmacy might be a safer alternative to balancing your hormones.
So one thing that we do a lot with bioidentical hormones is estrogen and testosterone and progesterone. So the hormones, when you go online and when you listen to conventional world, they're very much about, oh, this can increase your risk of breast cancer, ovarian cancers. What's different with bioidentical versus the conventional pharmacies?
Yeah, so with the synthetic estrogens and progesterones and testosterones that have been made, I almost think of them as a bootleg of the natural product. Essentially, with testosterone and progesterone and estrogens that we work with, they're derived from yams. They're bioidentical to what you make naturally. So as your body intakes them and uses them, it's going to elicit a more natural effect as if you made it yourself. But with the testosterone cypionates and the norethindrones and the ethinyl estradiols, those are all made to almost trick the body into thinking that they're the actual thing. And what can happen as a result of that is that it can have some carcinogenic side effects as a result, using your body in a way that's not natural.
So I've read these ingredients before and where they come from. horse urine is not uncommon for hormones to be made
yeah.
from the conventional side, correct?
No, that's absolutely right. Yeah, there are sources like horse urine, cholesterol from cattle that they'll use to derive testosterone from. There's a lot of very interesting animal sources.
I assume because it's from taking a shower in horse urine, I assume that's probably where a lot of those risks are coming from.
Absolutely.
So when you compound it and you use your pharmacy, you're a lot more protected.
Yeah.
It's not a perfect science, correct?
No, it's definitely something where you want to work with your medical provider and really hone in on levels and what the appropriate dosing is and everything like that. But yeah, it's definitely utilizing bioidentical hormones is a lot safer.
So on multiple occasions, I've had patients come to me from a conventional doctor and say, I'm on bioidentical hormones, I'm on the patch. And I will say, where did you get it? Did you get it at a conventional pharmacy like Walgreens, CVS, whatnot? Yes. So who told you they're bioidentical? My doctor. What do you have to say about that?
Yeah, that's a great question. So with that, those types of formulations, they synthetically derive them in labs in a way that increases the absorption of the medication in ways that are not necessarily natural. So they'll estrify things, they'll add different groups to make it more permeable into the skin. As it gets into your body, has to do extra work to cleave off these extra things that they add in the laboratory setting. And then it really taxes the body. And then there's these kind of side products from these processes that can really gum up things in the body.
Doesn't sound bioidentical to me.
No, and I always found it like not funny, more sad. It's like when you hit menopause, you go to your doctor, they give you estrogen, they give you the synthetic, increases your risk of breast cancer. They get breast cancer, then they give you a drug to block estrogen from your body for the rest of your life.
Oh, yeah.
Which gives you all of the side effects of your menopausal side effects of hot flashes and weight gain and misery and irritability, all the thing you went to the doctor in the first place to try and stop, and it's like a revolving door.
Oh, yeah. Like you go in with a problem and come out with an even bigger problem.
Yeah, and their treatment on that is, hey, let's just block that hormone
Sorry about your luck.
altogether.
Yeah.
It just seems so ass backwards.
Yeah, no, it's definitely not the right way to go about it, for sure.
Is there a way for you to make more hypoallergenic medications for people who are sensitive? We talked about like the ingredients that you do, but what would you do for someone who, I guess, just find out what they're sensitive to and just find an alternative to that ingredient?
Yeah, no, absolutely. Like with a lot of the commercial capsules that are made, like with the progesterone capsules, there's oftentimes gluten-derived ingredients, starches, and fillers that can be in those capsules. There's peanut oil inside progesterone capsules that a lot of people have nut allergies or gluten allergies. With what we can create, we can make a vegetable capsule that's derived from the same sources as the slow-release powders, just the microcrystalline cellulose, which is basically just broken down plant matter. And we can make that in a way that is just very friendly for the patients, very allergy-friendly.
And with regards to like hormones, so you can do creams, you can do troches, capsules, any of that stuff. And what do you think? I know everybody's different, but is there a delivery system that you think people are most effective with?
I would say, yeah, the lozenges and the topical, the creams are probably the most effective in terms of like capsules, for example. The bioavailability of the testosterones and the progesterone and estrogens are not really high. Like at the most, it's maybe about 10% bioavailable, but through creams and through lozenges, you're bypassing first pass metabolism from the liver, which the liver, it does a really great job at helping clean things up as you absorb things from your diet, but it also can be a little bit of a hindrance when it comes to hormone replacement therapy. So using your skin is a very great organ for absorption. Using your cheek and gum or under the tongue, those are also really great absorption sites because it just goes right into your bloodstream and it doesn't get that first pass metabolism.
See, and I like creams a lot because when you dose creams, if you want to try and adjust dosing, all you have to do is add a click, subtract a click.
Exactly.
Like it's really easy to adjust, and then you know exactly how many milligrams you're doing.
Yeah.
But taking a capsule, it's not easy to break capsules.
No, it's
and
not.
if you do, you're certainly not going to be perfect dosing. Same thing with other aspects like patches and stuff like that. So to me, creams are really nice. They absorb really well. I've seen most of my patients do really well with creams. But on the opposite, like the pellets, like it's mass dosing, and then they get a ride in the beginning, and then they just fall apart at the end.
It's a big roller coaster ride.
It's a big roller coaster ride.
Oh, yeah. Even with the lozenges, too. Our lozenges, you can quarter them, you can have them, so you can also have that same customizability with dosing. If you need to go up or down, you just take half a troche or a full troche, a quarter troche. There's a lot of customization there,
versus conventionally, they're like they have to buy a whole nother prescription.
Exactly.
And it's, and compounding pharmacies are awesome.
So,
Raintree Apothecary is awesome.
You guys really are, I have to say.
I really appreciate that.
So one of the questions that I'm sure a lot of patients would have is, do compounding pharmacies take insurance?
That is a great question. Unfortunately, a lot of the popular insurances, they do not. They want to refer you to more on the retail level where they have a lot more control over formularies, what's acceptable in their mind for patients to be on and what to take. So for the most part, for us compounders, it's unfortunate that, it's a lot of it's cash pay, unfortunately. But it's something where when you want to invest in your health, you got to invest in the best possible options for you.
Well said.
Again, if your prescription's giving you a bunch of toxins, you still want to get the most effective way so you feel your best.
Exactly.
And we preach that every week. So I'm sure a question's going to be asked as well. Is it as effective?
Yeah, no, absolutely. In most cases, more effective because we have that control to control the dosing, to control how your body's absorbing it. Some patients, if they don't do well in a lozenge, they might do really well in a cream. And everybody's different, which is why compounding and customization is just so important. And it's just wonderful to be able to walk through the journey with patients and just find out the best way to provide them with the best care.
All right. So tell us, how can people get started with your pharmacy? What should they ask their primary care doctor or their naturopathic physician to do?
Yeah, excellent question. So with that, basically I would say do your research in terms of location. Location is important in terms of the people who are working with the pharmacy. A lot of pharmacies will have websites where you can do some research, but call the pharmacy, talk with the pharmacist, see how well you gel with them, ask them some questions about how they compound things, where they source things from, and you can get a really good idea of if you want to work with them or not.
Awesome. So thank you, Dr. Corey Castorline, pharmacist who works at Raintree Apothecary, located in Scottsdale, Arizona, 480-912-5959. And we'll be back with another episode of Your Health as Well.
Thank you, guys.